Hello to all my health-conscious viewers. In today's video, we're diving into something crucial for anyone who's keeping an eye on their heart health: systolic blood pressure and the blood pressure chart. We're going to break down what systolic blood pressure is, why it matters, and how to interpret your blood pressure readings using a blood pressure chart. By the end of this video, you'll have a clear understanding of how to monitor your blood pressure effectively and what those numbers really mean for your health. Understanding systolic and diastolic blood pressure. Let's start with the basics. What exactly is blood pressure? Blood pressure is the force exerted by your blood against the walls of your arteries as your heart pumps it around your body. When you get a blood pressure reading, you'll see two numbers. These are your systolic and diastolic pressures. The systolic pressure is the top number, and it measures the pressure in your arteries when your heart beats, pushing blood out into your body. This is why it's often referred to as the active or pumping pressure. The diastolic pressure, on the other hand, is the bottom number. It measures the pressure in your arteries when your heart is at rest between beats. This is your baseline pressure, which is why it's sometimes called the resting pressure. Which number is more important? Now, a common question that comes up is, which of these two numbers is more important? For a long time, doctors believed that the diastolic pressure, the bottom number, was the most important indicator of heart health. The thinking was that since it reflects the pressure when your heart is at rest, it was a better measure of the overall stress on your heart and arteries. However, recent research has changed this perspective. Studies now show that both numbers are equally important, but for different reasons. Let's take a closer look at why. The importance of systolic blood pressure. High systolic blood pressure is often a sign of stiff or damaged arteries. This can be due to aging, high cholesterol, or other conditions that cause the arteries to lose their elasticity. When your arteries are stiff, your heart has to work harder to pump blood through them, which raises your systolic pressure. This is especially important as you get older. In fact, high systolic blood pressure is the most common form of high blood pressure in people over the age of 65. If you're over 50 and your systolic number is high, you might be at a greater risk of serious cardiovascular problems like heart attacks, strokes, or even chronic kidney disease. That's why it's critical not to ignore a high systolic reading. The risks of high diastolic blood pressure. While systolic pressure often gets more attention, don't overlook your diastolic number. Having an elevated diastolic pressure can also lead to serious health risks. For example, high diastolic pressure can weaken the aorta, the main artery that runs from your heart down through your abdomen. If the aorta becomes too weak, it can develop a bulge known as an aneurysm. This bulge can rupture, leading to severe internal bleeding, a life-threatening condition known as an abdominal aortic aneurysm. So, both numbers on your blood pressure reading are critical to your heart health, and both should be monitored closely. Using the blood pressure chart. Now that we've discussed the significance of both systolic and diastolic pressures, let's talk about how to interpret your blood pressure readings using a blood pressure chart. A blood pressure chart is a simple tool that helps you understand whether your blood pressure is within a healthy range. Here's a quick overview. Normal blood pressure, less than 120/80ths of a millimeter Hg. This is the ideal range, where your heart and arteries are functioning well. Elevated blood pressure, systolic pressure between 120,000 129 mm Hg and diastolic pressure less than 80 mm Hg. At this stage, you don't have high blood pressure yet, but you're on the verge, and it's time to make some lifestyle changes. Hypertension stage 1, systolic pressure between 130,000 139 mm Hg or diastolic pressure between 80-89 mm Hg. This is the first stage of high blood pressure, where you may need medication and lifestyle changes to manage it. Hypertension stage 2, systolic pressure of 140 mm Hg or higher, or diastolic pressure of 90 mm Hg or higher. At this stage, your blood pressure is dangerously high and requires immediate medical attention. Hypertensive crisis, systolic pressure higher than 180 mm Hg and or diastolic pressure higher than 120 mm Hg. This is a medical emergency, and you should seek help immediately. By regularly checking your blood pressure and comparing it to this chart, you can keep track of your heart health and take action when necessary. How to react to abnormal blood pressure readings. If you find that your blood pressure readings are consistently out of the normal range, it's important to take steps to manage it. This might include changes to your diet, such as reducing your salt intake, increasing your physical activity, or taking prescribed medications. It's also important to keep monitoring your blood pressure regularly, even if you're on medication, as blood pressure can fluctuate over time. Remember, just because you're taking blood pressure medication doesn't mean you're completely out of the woods. Studies have shown that people who are managing their blood pressure with medication still have a higher risk of heart disease compared to those who maintain normal blood pressure without medication. This makes regular monitoring and healthy lifestyle choices essential. To wrap up, both systolic and diastolic blood pressure numbers are crucial for understanding your overall heart health. High systolic pressure can indicate stiff or damaged arteries, while high diastolic pressure can lead to serious conditions like an abdominal aortic aneurysm. By using a blood pressure chart, you can easily interpret your readings and take the necessary steps to keep your blood pressure in a healthy range. If you're serious about managing your blood pressure, make sure you're tracking both numbers regularly, following a heart-healthy diet, and staying active. And of course, consult your doctor if you have any concerns about your readings. Thank you for watching, and if you found this video helpful, please hit the subscribe button and the bell icon so you don't miss any of our health tips and advice. Stay healthy and take care.